A 32-year-old patient attempted fasting for 72 hours for the first time. At 65 hours, her lips turned blue and her heart started pounding as if it was going to come out of her chest. Was this a bad thing? Was it dangerous? Let's talk about that. When you stop consuming calories, your body goes into an endocrine fight between your thyroid and your liver. It is a strive for survival on who's going to metabolically manage the body. When calorie consumption stops, the human body uses two endocrine systems to try to save the day. It's a battle between the thyroid and the liver, and they're both trying to save the body through a metabolic puzzle. The thyroid begins with its very close, tight connection to our metabolism. And when calories stop coming in, the thyroid sends out a major signal to shut down the system, decrease the rate of the heart, decrease the body's temperature, and for heaven's sakes, do not try to repair anything within the body. This endocrine signal is very strong and happens robustly within those first 24 hours of fasting. And it is in striking contrast to what's going on in your liver. Your liver says, hey, I could make a different fuel. Let me work on that and supply an abundance of energy so that we survive this time of no resources. When patients attempt to fast for an extended number of hours, like 48 or 72 hours of no eating, and during that time, they get a profound level of fatigue, it is a signal that this stress test, this time without any calories, has really been too much for either their thyroid or their liver or both. Let's take a look at this patient. This young woman who was attempting to fast was not new to stressing her metabolism. She'd been using the ketogenic diet for over a year and had improved her metabolism by limiting the number of meals she was having during the day. These two red spikes are when her blood sugars rose and fell after eating. Her production of ketones was not insignificant. She had a baseline ketone production that was a little above 0.5. And then 24 hours into her fast, a transition happened. The glucose production fell. She was no longer eating glucose and she'd used up all of her storage, while the ketone production coming out of her liver was like a tsunami of energy. As she continued to fast through the next day, she peaked her ketones at over 3. It was during this time that her heart was palpitating and the energy seemed to pour out of her body. This is when she got a little freaked out. So was it safe? Well, the answer in this 34-year-old female is yes, it was safe. Her body's production coming out of the liver won. At the same time, her thyroid was sending out the APB to shut down that heart rate, decrease that core body temperature. The liver was in process of rescuing her metabolism by producing an abundance of ketones. This wasn't something she mastered over the last 2 or 3 days. This was something her body had been practicing for the better part of 6 months. In that first 24 hours, her body did shut down that blood supply. Those extremities, including her fingers, nose, and lips, had less blood supply in preparation that her liver couldn't do what it did. And she did get cold with some blue lips. But that pounding of her heart was also in response to a tsunami of energy that had come out of her liver to respond to this lack of resources that she was eating. Although she was uncomfortable, her body did respond to this stress. If you're watching this and saying, but I'm not a 34-year-old female and I haven't lost 30 pounds on the keto diet for the past year, so is it safe for me to fast? Especially if you have the symptoms of getting very fatigued or a pounding heart when you do fast. Well, the answer is similar to the one I would give to somebody trying to begin an exercise program. I would not send you out the door to run 26.2 miles on the first day of that program. Just like when you're enhancing that body's metabolism, I would not ask you to fast for 48 or 72 hours in the first season of improving your metabolism. It is only through a graceful advancement of metabolism that this patient's success story was accompanied with a improvement in her energy, better brain function, and that 30-pound weight loss. If you want to learn more about how to walk through this keto continuum in a safe way and when is the best time to fast, check out this video. I'll teach you there.